Okay, so a common question that I hear is, in the midst of growth spurts, is baby getting enough? And on the other side of a growth spurt is mom's concerned on making too much. And they'll say, I think I have oversupply. Okay. So growth spurts are expected at 7 to 10 days, 3 weeks, 6 weeks, 3 months, 4 months, and 6 months. Okay. So, but the first beginning ones, the 7 to 10 days, 3 weeks, and 6 weeks are going to be the expected. Oh my goodness. It's pretty intense.
Yeah.
7 to 10 days is just 1 week old. So we've got the milk coming in around day 3 to 4, kind of baby's happy, milk is in. And then what happens during a growth spurt is baby's bones are growing. Okay. And if you remember being a teenager and your bones get achy and it's uncomfortable. And so they're more wakeful, they're more fussy, wanting to feed frequently, often wanting to be held a lot. They love the womb, of course, and that's like what they knew. But when you're not feeling good and they're just more alert, I'll have moms wear them and just try to keep them with you. You will feed on demand, and this will help baby get enough, because often mom's like, something must be wrong. Baby's obviously not getting enough. Look how much they're crying. I feel so soft on my breast. I feel like I don't have enough. A growth spurt takes typically 2 to 3 days for the milk production to boost up, could be upwards to a week later, like at the 3 or 4 month mark when the milk supply is very established, and that demand may take upwards to a week to boost up to the next level. So just some understanding on any demand we do, the body's a little bit delayed on that increase. But what we see on the other side of that growth spurt is they do a good job with their frequent feeding, and then hello, milk production. So a common question is, how does my body know to keep going up to the next level and making enough milk? I'm only making 1 ounce per side in the early days. How does it know to make 6 ounces, at 6 months? And so these growth spurts along the way are what tells mom's milk production to continue to upswing for baby's need. Okay. Now, on that other side with, oh, great, baby did an amazing job. Now we have a bit of an oversupply effect because the body has taken in this demand, which in turn boosts it up. Now baby, then all of a sudden it's like, I'm really full and firm, and baby is gulp, gulp, gulp. And then therefore needing to burp more frequently because taking in more air with those gulping swallows. And as baby's getting bigger with their fat pads in their cheeks, their ability to transfer is faster. So burp frequently. Positioning. I have my little baby here. Here she is. We're matching today. But with the laid back, you'll hear called laid back breastfeeding, is leaning back with the breastfeeding. Can you see on the video good?
I can see you.
So with the laid back is leaning back a bit so that baby is opposite of gravity with milk flow, and this will support the breast here. And then you see the angle here. So baby's having to work opposite of gravity, which helps if the milk production has really kicked up and we have, gotta love that I have all these fun things. I have a breast here. So if we have the breast like this, let's get the camera down a little bit. And so then you guys can see that the flow is straight down the throat here. Okay. Yes. When we're dealing with this oversupply kind of effect, we can go ahead and do a normal latching to get baby on. Okay. Such as like a cross cradle hold. Then we wrap around, watch baby's nose, and then we're going to lean back. Get pillows around you. It can be comfortable for your neck as well. But I mention this because the intervention with positioning and latching is so important with that faster flow that comes on the other side of a growth spurt. So the lean back helps. The other thing is when you're breastfeeding, depending on the hold, you can take your hand like this and give a little indentation towards the breast, which then think of the ducts open like a hose, and we give a little press, which can help with these higher ducts and gravity, to kind of just give a little press here. If you're more on a scissor, you can take your hand and just do a gentle press. Be careful it's not towards the nipple like with flow, but more of a press in to help with that fast letdown. Okay. You'll hear it called forceful ejection reflex, and that's with that fast flow that you'll hear moms talk about. Some feel a tingly sensation with the letdown. Others just hear baby gulping, or if you were pumping, you see the spraying. But with that, sometimes it is overwhelming for babies. So with a growth spurt, we've got that higher flow, which in turn leads to baby dealing with those symptoms, which I mentioned, the choking, gassy, needing to burp a lot, spitting up more because they're taking in a large amount of milk in a short amount of time. So look out for spitting up. And then fussy with that gassiness. They're sometimes irritable, and mom's like, what's wrong with baby? So I just like to mention, well, interventions with the high flow effect, and then baby upright. If you've taken a large amount of volume in a short amount of time, maybe for about 20 minutes, 15 to 20 minutes, keep baby upright as they're handling this higher flow after a growth spurt.